Hey gang, Dr. Mark Rogers, Disc Centers of Largo. Wanted to say hi to everybody. Want to talk a little bit about discs, back pain, spinal decompression, and things like that. So I've got an MRI of a patient. I got his name covered up and asked his permission. But this is a T2 weighted image of an MRI. So the spinal cord shows up as white and the discs show up as white because fat and water show up on white as on a T2 weighted image. So if you look at the discs here, the discs look pretty white, don't they? Now, as you come in here, this is his L2, L3. Look how dark that is. And on the axial image, this is where he's having a problem. The patient's had pain for several years, been to lots of different doctors, nothing seems to help. But look how much water this disc has lost. So this is the one that decompression is going to be focused on. Now, how can it get water back in the disc? That's a question I get a lot. What decompression does is it puts the patient on their back, and it slowly stretches the spine and opens it up so it can get water, blood, and oxygen nutrients back into the disc. In fact, hot off the press is a study that was just done in 2025 by the University of South Florida. They have a chiropractic chair there. One of our chiropractic PhD researchers is a professor of the neurosurgery department, and they actually have a DRX 9000 with the neurosurgeon. So this study took a bunch of patients, and I'll talk about it, and it was read by radiologists. They did pre and post MRIs. One of the radiologists is Dr. Scott Thorpe, who's a good friend of mine in St. Pete, and he reads a lot of my MRIs too. So what they did was, and I'm going to read the synopsis of this study. They had 13 patients. It's not a really big, broad study, but that's sometimes with chiropractic. We have to do that. We don't have the medicine and pharmacology behind us. But basically, they had a broad presentation of intervertebral disc lesions in their selected sample in pre and post interventional MRIs. And after diagnosing the disc lesions on an MRI, these patients received 20 treatments of non-surgical decompression delivered with the DRX 9000, which is what we use. Clinical examination was performed, measures of pain, disability, and subjective improvements. Here's the conclusions. Here's the main thing. The results demonstrated that there was a significant improvement of pain, 80%, which is kind of what we find with patients, sometimes higher, disability 50%, and subjective recovery of 75%. This is the interesting thing. Can't speak today. Both the average disc height and canal, anterior and posterior, increased. Thus, non-surgical spinal decompression, conservative, good to excellent clinical outcomes as conservative non-surgical treatment for intervertebral disc lesions. So basically, on the post-MRI, there was more hydration in this disc and there was increased disc height. So this is the kind of thing that we do in our office. I always like to sit down with patients, no obligation to talk to me. Give us a call, 727-581-2774. I love spinal decompression, and if you or somebody you know is suffering, just give me a call. I'll be glad to talk to you. And if you're not in my area, we'll find somebody that does this kind of work. Have a great weekend.